Tom. Great being with you again. This time is something that I love to do, and that is recognizing excellence in our field. You know, almost 15 years ago, when I was in your shoes at the CED, I realized we don't recognize sufficiently excellence around and came up with the idea of awards. Do you care to tell us about it?
Well, Yadin, your shoes are so big to fill, brother, but glad to be here with you as well. And so we're going to speak briefly about the CED awards and the GCEA awards, and then turn it over to our colleagues to tell you more. So the CED awards, three of them: the individual award, the IFMBE CED award you see here on the website. A second one is the Clinical Engineering Outstanding Teamwork Award, and that's teams within a country. And then third, the Best Clinical Engineering Article and Conference Paper Award, 2 awards we give every year. And I'll say quickly, nobody but the best wins the IFMBE CED award. And the first one was Adriana Velazquez of WHO, our wonderful colleague. And Dr. Jim Weir there first in 2015 and Dr. Jim Weir in 2018. Now, a variety of folks have won the Outstanding Teamwork Award, and a variety of great folks have won the Best Conference Article and Paper Award. So these are great awards, and they're doing what you set out to accomplish. Dr. David, over to you.
Great. And to complement the program of recognizing excellence, now with the Global Clinical Engineering Alliance, we added one more category, and that is the Collaborative Capacity Building Award. The GCEA Collaborative Capacity Building Award is giving this year for the first time ever. And the concept here is to recognize and promote models for national society interaction on global level in promoting the field and the cooperation in the field. So this year, we are happy to see that JACE, the Japan Association of Clinical Engineering, is winning it. They have specific committee that dedicated to international work and for public awareness. Excellent work. And I tell you, between our organizations, we have now a recognition program that will show how excellence and model are being practiced in our field.
So Yadin, you tipped the hat on your award, but I'm not going to on ours, but it is about exceptional contributions. And let's listen to Keiko and Fabiola tell us more. Thanks.
Great, looking forward.
Hello everyone. What an excellent opportunity to greet you and share the good news with you. As you know, the Clinical Engineering Division established a series of awards to recognize the extraordinary work of our engineers worldwide. And this time we want to acknowledge those who had exceptional performance in their professional endeavors. As coordinator of the awards committee, I had the opportunity to meet individuals and working groups that show the value that clinical engineering provides to health system through their publications and proposals that the global community sent. This year, we received a record number of proposals with an authentic representation from all world regions. Thank you for your participation. Selecting the winners was not easy, but we believed that they represent the best clinical engineering in the world, and that is why we honor them. By the way, I want to acknowledge the awards committee for their extraordinary work. Thank you, Jadine, Tom, Paolo, Eva, James, Miladen, Leisla, and Alan. And now the awards. In 2021, 29 articles were published in the journals Health and Technology, Journal of Medical and Biological Engineering, Global Clinical Engineering Journal, and Research on Biomedical Engineering. In the conference paper modality, the 33 papers presented at the following events were considered: 15 Mediterranean Conference on Medical and Biological Engineering and Computing, 7 International Conference on the Development of Biomedical Engineering in Vietnam, 8 Latin American Conference on Biomedical Engineering, 4th International Conference on Nanotechnologies and Biomedical Engineering, and International Conference on Medical and Biological Engineering. The manuscript award for article journal is to Bench to Bedside, The Technology Adoption Pathway in Healthcare by Daniel Clark, Gerard Dean, Sarah Bolton, and Beth Wilson from the UK, published in Health and Technology. The manuscript award for conference paper is to Smart Aging, Are We Succeeding? From Barakovic Hosik J., Barakovic S., and Serutinarevic A. from Bosnia and Herzegovina, and the paper was presented in the International Conference on Medical and Biological Engineering. We have a special mention on this award, and is for the journal article Clinical Needs and Technical Requirements for Ventilators for COVID-19 Treatment Clinical Patients, an evidence-based comparison for adult and pediatric age, published in Health and Technology by Martina Andelini, Simone De Santis, Federico Nocchi, Elena Bassanelli, Leandro Pecchia, and Matteo Ritrovato from Italy. Congratulations to the winners. This year, we received 10 proposals from candidates from Bosnia and Herzegovina, United Kingdom, Sudan, Turkey, Switzerland, Mexico, India, China, and Venezuela. The quality of the work developed by these extraordinary teams led us to have 2 winners. London Clinical Engineering Network, led by Ruth Thompson from UK, and the Department of Clinical Engineering and Information Technology, the first affiliated hospital Shenzhen University School of Medicine, led by Jinji Feng from China. We also have 2 special mentions for Berlab, led by Almir Vanjevic from Bosnia-Herzegovina, and Andhra Pradesh Medtech Zone Ltd in India. Congratulations to the team winners. In 2021, we celebrate the achievements of outstanding clinical engineering career reflected in our recipient's vision and leadership, and appreciated by the work and progress made in his country. The Clinical Engineering Division Award goes to Alexandre Ferrelli Souza, from the Associação Brasileira de Engenharia Clínica. Parabéns, Alexandre, and keep inspiring us. On behalf of the Clinical Engineering Division, I thank all of your participation in these important processes for the clinical engineering global community. I'm waiting to greet you in person. I send you a fraternal hug. I am Fabiola Martinez. See you soon.
Hello, I'm Keiko Fukuta, a member of GCEA Award Committee. I'm very delighted to explain GCEA Award description, criteria, and procedure for selection. This award recognizes groups or society for their contribution toward collaboration with other countries to improve their knowledge, education, capacity, and status in the clinical engineering field. The effort of the nominated group or society that have gained global recognition in the clinical engineering field, healthcare system, and the community through a demonstrated combination of the 3 categories: professional capacity building, collaboration, and contribution. Professional capacity building evaluated capacity building program, cross-training program, original scheme, attendance demand, lecture and practice developed of the skilled professional workers. Other collaboration is the relationship between different countries, regions, or organizations, effective work and achievement, good partnership, and a sustainable collaboration environment. Contribution assessed as a very important topic, sustainable, benefit both parties, contribution to the patient safety, medical technology and service, and the social philosophy and the culture area. The application period was from 8th August to 10th September. Several groups were nominated, and we finally evaluated them based on the criteria. Based on this comprehensive evaluation, we are very honored to announce the first GCEA Collaborative Capacity Building Award. The winner is Japan Association for Clinical Engineers, which has been contributed to the development for the capacity building of the clinical engineering field between Japan and Myanmar. Congratulations.